Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from experienced medical practitioners. And today we have Dr. Suresh Ludhwani with us. He, with his amazing experience in the field of oral medicine and radiology, is doing exceptionally different with what the regular people do. So he has his own diagnostic setup by the name Oroscan, as well as he's working on the aligners, as well as a lot of different things that he has been trained internationally and hence implementing here. So he's here to discuss what all interesting things he's doing. How did he find his path after doing his post-graduation in oral medicine and radiology? And how do he see the things progressing in the field? What is the scope? What is the opportunity for a postgraduate in oral medicine and radiology? And hence, we are here to discuss all these interesting things, and I'm really waiting to understand all these amazing opportunities from him. Thank you so much, Dr. Suresh, for coming on the platform. It's really nice to have you here.
Thank you so much, and I appreciate your efforts for doing something for the society, and this is something really good that we can share what we learn, and I'm more than happy to be here, and thank you so much.
Thank you so much again. So, we are glad for you to be here to understand from your experience. So let's understand, a brief of your journey. How did it unfold? How did you figure out your path after your post-graduation?
See, like I would just say that like in every other OMDR individual, it won't be the choice of field. Like we all are being put in our mind while in our bachelor's that it is like an what we can non-clinical field, right? We all have been put up to such thoughts that there is no future about it.
Yes.
So I was had the same mentality. But as soon as after post my graduation, I was in the same dilemma. I want to move out of the India, and at the same time, I belong to a medical family, so it was like I could be here, and I would have a good support from my parents. They are not from my dental background, but they are belonging to medical background. So I stepped into both boards. So I had a TOEFL exam on the day after my counseling. So in counseling, I was getting this branch. So everyone was there that some people told me you are just spoiling your life because this field doesn't have scope, and some told take it into this, it doesn't matter in which field you are doing your masters, ultimately a dentist can do everything.
Yes.
So it doesn't matter. This is something everyone passes through, even I passed through. But I chose, okay, I just went with the flow. That okay, fine, if it's OMDR, it's OMDR, nothing matters. I got into it. So since I was in my same parent college in which I did my bachelor's, so everyone knew me. So at the same time, everyone had certain level of expectation. So when they saw me in OMDR, they were like, "Oh, why did you spoil your life? You would have stay back for another year, and then again you would have applied." But I think that a year is more than just the 365 days. That year will play with your mind. You might think of doing something else. You might waste your time. You will do everything. So I just chose that this is, if I'm getting an opportunity, never say no to any opportunity in life. So I said, okay, I will go ahead. So as soon as I'm in my department, so my seniors, not from my department, but from other department, that why don't you go that every six months you do one posting in different department. So at the end of the 3 years, you know everything. They were fun, people were making fun, but at the same time, it was putting me little down that okay, this field is so degrading that no one is accepting it.
Yes.
So this is how it kind of provoked me that I need to prove that there is something to do. There is some ray of hope in it. So one day I went to my guide. I told him that I need to do something in radiology. I like radiology. Maybe I'm not that keen on medicine, but I like radiology. So I took my thesis on radiology, and I was there in the, out of most of the time I used to stay in my OPG room. If I see anything new, I will go and ask him that what is this. So this was the curiosity which was there in me for radiology. So I put up like I will go through it.
Mm.
Then as soon as I passed my masters, I had that thing that okay, I am going to do something in my dentistry, general dentistry, but I have to do something in what I am mastered. I
Mm.
have to begin with it. Then subsequently, I might move to general dentistry. This is what I had thought of.
Mm.
So I started moving out. I started going to people who have succeeded, means who have started building up a center. At that time, it was new, around 4 years back. So I used to go alone in the trains, and I used to go to Mumbai, Delhi, and see that what people have done and
Mm.
how they are building. So this is how I started. Then once I thought that I need to start up a center. So I that was a huge amount at that time. It was like 50 lakhs you need to invest, and it was impossible for me that my father will give ja beta,
Yes.
lil. So, and you never want to burden your parents.
Yes.
So I started finding people who have a same mentality like me and
Mm.
who would like to venture in this.
Mm.
So I went to a senior who was an oral pathologist. I went and we met for a coffee, and he had the same thing in my what I had, that let's do something in our field first.
Mm.
So this is how Oroscan got birth. That
Ah.
we decided to build up a diagnostic center called Oroscan, which had oral path and oral radiology as a services.
Mm.
So the next thing was that how to build up the finance,
Yes.
right? So you are putting up a venture which is 45 lakhs rupees, and mm, what we did, we were four diagnosticians, and each one put up 4 lakhs rupees,
Okay.
and rest of was taken as a loan.
Okay.
So this is how we started.
Mm.
And initial few months, even I was learning.
Mm.
So it was like we were not putting up any profits and everything. But at the end of 8 months, 9 months, we realized that okay, through this we know how to generate money.
Mm.
So from that we started. From one center we moved to second to third, and now we are 15.
Wow. Mm.
So now 50 at this stages of 15 centers,
Mm.
there are many people who have been part of it.
Mm.
There are many diagnosticians who have been part of it, and the center Oroscan brand is because of all of them in this.
Correct.
Because if I was the one who was ruling it, then
Wouldn't have.
Oroscan wouldn't have succeeded, because every individual has a gray shadow.
Correct.
So there would be like you have a positive things, you have a negative things. So I could be more ambitious, but there are people who would hold me up, who
Yes.
would tell me, okay, this is the right thing, this is the wrong thing. So I
Yes.
would say my partners, diagnostician partners, and my staff are like a real hero behind building up this chain.
Correct.
And I feel this is just the beginning of it. We are much long to go.
I'm sure. I'm sure. Definitely. So that's true. Maybe it's just the first step. You start, attracting the same like people. The same minded people, like minded people to you, and hence you grow. That's correctly said. So now, when you figured out your path into this, oral radiology, how do you think it is evolving now? Since these years of establishing, since you passed out till now, how do you think it is evolving, just to and how do you think the future of oral medicine and radiology, especially in India, how is it changing now?
My simple, I think is one thing is I really feel I should be proud of, or I should be depressed, or I don't know.
Mm.
But if you ever go to any cancer research institute around you, there
Mm.
are 100 new cases every day.
Mm.
That as a diagnostician, that's your failure rate. Those patients have reached that stage because at a primary stage, as an oral cavity specialist, we failed to guide them that okay, you guys have this problem. you could have stopped with an first ulcer.
Correct.
So if I feel I should be proud, I am in a field in which there are every day 100 new cancer patients, or I feel depressed that okay, these are my failure rates. I didn't able to diagnose them at the time they should have been. So there is a lot of scope when we consider as in medicine and radiology, because both are interconnected.
Correct.
And a disease can be diagnosed with a clinical and radiological examination. Only one examination can never fulfill it. So I would suggest that yes, it is lot of scope which is there, but the issue is there is a mind block in people. As a student, when I did it, even I had it. So there are people who want to. No one wants to go to periphery. No one wants to have a small money. Like if I do a biopsy, I charge 2,000. But people don't understand. If I do a 25 biopsies in a month, I earn 50,000, and my investment behind this is peanuts. But I would suggest that I would do 2 implants and earn 50,000. So that's a mentality everyone is holding. That I would earn a quick money, but people don't understand that now in clinics, even getting 2 implants is difficult, because there are many people who are as good as you are in doing implants. Why not people give them a chance? So if you have given 3 years to certain field, why don't you expertise in that field? And the another second drawback I feel is that we are never shown that what else we can do with oral medicine. In our clinic, in our graduation, post graduation, we do an examination of the patient, send him to another patient. Never anyone is guiding them and telling me, okay, you can do TMD, okay, you can do ultrasound, you can do ultrasound therapies, you can do this. So that's a block. There's a block maybe at an institutional level, that we are not given some ray of hope that outside this world there is an hope for it.
Correct.
I feel very bad when people feel that I just did it for the degree. You will hear that people saying I just did it for the degree. So that is something very disheartening. If you are doing it, then don't waste your 3 years. Rather than do 3 years clinical practice and do it. There are many BDS people who are successful. That's a mind block that people see MDS and come to people will see how your good work is, how you have a good name in the society, and then they will come to you. So you will see many senior practitioners who are BDS and they are ruling the practice. If MDS was the thing, then they would have never got that practice.
Yes.
So that is something very foolish of people to think. So I will really think that if you are giving your life 3 years to something, you should work on it. And there are ways. There are 100 ways to do different things in a different way. So I feel oral medicine has a lot of scope. I would still suggest people to think of temporomandibular joint, think of other investigation except CBCT. I have seen people reporting for CT, MRI, and USG, and they are my OMDR colleagues. And I feel like I need to learn from them.
Correct.
I have blocked myself to CBCT. I should go and learn and be with them for a week. So that kind of mentality is necessary, that there is things to do.
Yes. That's so correctly said. The mentality to grow is very, very important, to learn and to grow. If you have that mentality, it actually helps you to get a better practitioner or a person in general. So now when you mentioned that there is a lot of scope in this, so just wanted to understand, after just passing out from the college, what are the kind of job opportunities if a person wants to look forward to, or
Yeah. See, now again, I would suggest that what kind of focus you want. For example, I would say that what are the things I have came across and people can think about it. That is, I recently SCG, it's a cancer institute, had put up a PG diploma in oral oncology only for physicians.
Okay.
That means I would say oral physician, OMDR like us. So that was a fellowship which everyone could have scoped. Even I was wondering I should have done, but it is just I can't now leave everything and go there. But
Yes.
that was one hope. Second is temporomandibular joint disorders. There are tons of patients outside. What we do is give a Den MR or a Flexon MR that, okay, this is a muscle relaxing, things would be fine. But we know that it is a neuromuscular disorder. It has many other things to deal with. People need to get into this. Third is a simple oral lesion. If you just practice and tell the society, like your clinical practitioners, that I am exclusively doing oral medicine, there are, imagine your oral cavity is full of lesions.
Yes.
There you will, hundred of patients are there. They will refer to you, but there is no such people who wants to do that thing. Oral lasers are is an upcoming branch. Laser dentistry, then you can do a lot of things. So you can get into that thing. And I would along again with radiology, why you want to stick to only CBCT? Why don't you upgrade yourself? Why don't you start learning CT? Why don't you start learning MR? So I have seen, I'm not saying that these are things which I feel it could happen. No, there are people who are already doing it. So if you are into general practice, then you should need to understand that there is something which you missed out, which people can do. People are already doing it. So these are the all different things you can always try out. And there is always, you can always, if you love teaching, when I say teaching, it is pure teaching. I was a part of a college, but somewhere I felt that I had stagnancy in my learning process, and I am not a great teacher, if I would say.
Okay.
And but the people who love teaching, they like interacting with students. So there is a good scope that according to the DCA, everyone needs to hire. So there is always a vacancy which is present. So, and since if you are aware or not, but OMDR branch was not working for another 10 years in between. Okay, in Gujarat, it was blocked for 10 years. So people could, there is a good scope. There are not many passing out. Yeah.
Correct. So I can see immense scope into this, especially with specialized practice, as you mentioned, as well as lecturership. Definitely, these two are fantastic branches. So now, when you suggest, these kind of job opportunities, and when you mentioned,
I can't listen to you. I can't hear you.
Can you hear me now? Just a second. Hello, Dr. Suresh, can you hear me?
Sorry, I can't listen to you.
Can't listen to me.
Can you speak now? No.
Hello.
Yeah, now it's good. Can you hear me?
Yes, I can hear you.
Yeah.
So now, when you mentioned about previously that settling down in peripheries, how do you and you also mentioned that becoming a specialized OMDR, working only on lesions, working on only on different kind of lesions or temporomandibular problems or anything of that sort, becoming a specialized in what you like. So do you think these kind of opportunities are there in peripheries also, in tier 2, tier 3 towns also? Will that work for people who want to settle down in their hometowns?
The future is tier 2 and tier 3.
Okay.
Tier 2 and tier 3. The future is it. See, every individual, like we have dentists a lot. Okay, everyone wants to settle in city.
Metros, yes.
Right? So the future is in tier 2 and tier 3. Just imagine, I will just think, as in, since I'm a Sindhi, I like to think yes, everything in a business-minded way. If you now, every business, you go and ask any entrepreneur, they would never put up something in a city, they would put up something in the best tier 2 and tier 3 cities. First is, if I want to put up a big radiology center, where I will get the cheapest rent.
Correct.
Where I will get no competition over there, where I will get a bulk of patients over there.
Yes.
So even as in if I think of, if people think that how much I would earn, everyone have that kind of mentality. Just think about it. That what if I'm getting into a zone in which I don't have any competition, what's my future?
Correct.
Right? So second is people is like everyone have that mentality that वहां पे तो किसी को पता ही नहीं है कि
हाँ,
ये
yes.
yeah, everyone feels
हाँ,
that thing.
हाँ, हाँ.
And imagine like a Geo card, Reliance Geo.
Reliance Jio, yes.
Okay, now what he is doing it with this providing free SIM cards, right? He is almost providing free internet. What he is doing is he is building up a setup.
Hmm.
He's building up. He has brought Geotech media in which there are shows, series, and everything.
Correct.
He's building up his telemarketing. He's building up his shopping, online shopping. What he is doing is making awareness at the same time he's building up a client. So why don't you take this as your business?
Hmm.
If you are going up and building up something, you need to educate them. You need to tell them, okay, this exists. It might take an year, but imagine after an year, that entire population knows that there is only one God out there, which is you, because you have done everything. You have done it is not only about just money, but at the same time they will get such awareness which is done only by you. No one else did that efforts to come down into that small city and educate them that okay, a ulcer in an oral cavity can also be a malignancy. No one did that thing.
Hmm.
Imagine now if you go to any oncology institute,
Hmm.
there are people who come in buses from a small town
Hmm.
because they have nothing over there.
Hmm.
So there is a great immense scope in India. I would say India because India is filled of population.
Yes. Yes.
आप इतनी पॉपुलेशन को बीमारियां होने वाली हैं, इतनी पॉपुलेशन को ट्रीटमेंट की जरूरत है ही,
Yes.
इतने पॉपुलेशन को इन्वेस्टिगेशन की जरूरत है ही.
Hmm. Hmm.
But we have a very limited scope in our mind that there is no paying capacity,
Correct.
there is no education over here. See, India is a country of mass, not we I would say there are a lot of things to do it, but at a cheaper rate,
Correct.
because our economy is slightly backward.
Correct.
Still we have the volume.
Hmm.
In a city I might do one patient,
Hmm.
and on this in a small town I might have to do three patients to earn the same.
Hmm. Hmm.
But that three patients will build up my entire career, because it is just a beginning over there. In
Hmm.
a city, in an established city, this is the highest you can reach.
Correct.
So in that way I would say that tier 2 tier 3 city is something I am thinking to target. I don't know what people will think, but I will think to target it.
No, no, that's great. So, we are here to understand your opinion when you have been into this space for so long. I'm sure this is of a lot of value. So now when you are there with after this, I really want to ask, you have done a lot of courses in aligners and in many different things, after your post graduation. What were those, and what are the kind of courses that you will suggest for the postgraduates as well as graduates that they should go for, especially now in this time, because there are a lot of people struggling, and I'm sure this is the best time to cover up this time, to grow and to improve yourself. So what are these kind of courses that you will suggest?
No, no, in the beginning, I would suggest that if anyone is expecting an overnight success, that is impossible. First thing. Second thing is, I have a simple attitude in my life that I will never say no to anything. Anything. Even if I would see a composite course, I'm not going to do a composite, but I will still learn that thing because I want to see that how that presenter present is presenting the course.
Hmm.
I would learn something different from that thing. That is one thing. So never say never to anything.
Hmm.
Second is now if we are concentrating on only on oral medicine, what I did it and what I think.
Yes.
I started up when I established Oroscan.
Hmm.
I started feeling the heat. Okay, today or tomorrow I'm going to face the competition.
Correct. Hmm.
What will make me stand out or stand different from my competitors?
Hmm.
This is what mentality I hold it.
Hmm.
And I started thinking in that way that what else? I can do. And every day, every year, there is a question that what else, what else, what else. Okay, this is how I started. So I first went, I was thinking of doing something related to radiology. So 3D printing came into picture. That what I can do using a 3D printing or 3D scanning, which I call CBCT, and build up something, I can combine it. So I learned 3D printing. I went to Germany and went to Poland and learned about 3D printing. So imagine now when I came back from 3D for learning 3D printing and I'm approaching people, people thought that 3D printing is a kind of a paper printing with a 3D effect. Okay. So I have started I won't say educating, but telling them what it is. Correct. And it took me 3 years to make people aware that it would be a application which would be used in everyday's life. Everyday dentist would use this thing. If I'm preparing a surgical guide with a 3D printing, I'm happy to see that how nicely implants are being placed. Yes. Go and see 10 years back OPGs of post implants. The implants are placed like I can't comment it. They are placed like that. So when it is not they are wrong, but at that time the services were not available. Now the services are available and they can use it. So the first step was 3D printing, and then I started with 3D printing and got into surgical guides, implants. So then after that, I realized that in 3D printing and in radiology, how can I combine and do different things? So then I approached my orthodontist colleague. Let's think of something about aligners. That is future. If a patient is from Bengal and he just have a midline customer, yes, why can't we give him some treatment from Ahmedabad? Correct. So with this thought in our mind, we started that okay, let's do something, and we brought aligners and pictures, and with God grace, we are doing great in aligners. So after aligners last year, when I was thinking, okay, I'm done with 3D printing, and what next? What next? And now, since I was married last year, I thought that my wife keeps on complaining. What should I do that ease my work and at the same time, I can spare certain time? So I just came across artificial intelligence. So artificial intelligence is something that it is not a substitute of an human, but it is can be an associate to a human. Correct. So with the help of artificial intelligence, we started preparing the reports with the softwares in which my manual efforts became reduced. I just need to go through it. If I upload a CBCT data, I can get the entire report generated from the software. I just have to go through it. Correct. And give a report. So there is a lot. I can say. I can understand. And artificial intelligence today, software today, and there are only two software. Okay, two companies who are building up, and it's something. Just keep my words. There would be every diagnostic center would have their own software in near future. Because it is not any great task. Yeah, because if you have a data scientist along with you, you can easily build up a software. You just need a machine learning. You have to teach your computer that to see. जैसे आप किसी बच्चे को सिखाते हैं वैसे you will teach him that कि ना okay this is periapical abscess, this is caries. After 1,000 cases that computer would learn, like a baby would learn, he would learn, and you will get a software which can give you a reports. So that is one field. I have my colleagues who are doing something on TMD, which are again the part of Oroscan. So I feel that out of limitation of time, I can't jump everywhere. So I propagate them that they should do. There are my colleagues who are into lasers. There are my colleagues who are into like pathology. So I have many people within my Oroscan to get inspired from. Okay, he has done this much. I need to do more. Yes. So many things can be done, and you can always think. Google can be used in a positive way also. If you write something that what else things you can do. You can read articles, then you will realize that there are many things which can be done.
Correct, correct. That's so correctly said. And nice to know, how did you ask yourself questions and progress it accordingly with the years to come. And that's really nice to know, and that helps to understand that how everyone can actually do it themselves. In fact, me also, how can I grow myself? So now, when understanding how did you pick up things to grow yourself as a person and establish different areas for yourself, what is your suggestion for the current postgraduates? How, with the current pandemic, things are very difficult for many people when it comes to getting experiences as well as establishing themselves. So what is your suggestion for them? How can they overcome this time and create a better world for themselves?
I heard this is, I know that we are losing out many people, which is wrong, But it has given us a lot of time to think over it, that what we want to do it. We have a lot of time. The work is not that great right now. We can understand, and it would be there for certain period of time till everyone get vaccinated. So we have a lot of time to think over it.
Mm-hmm.
Now, one thing is, you just need to understand that pandemic has opened doors like anything. The amount of webinars have happened. The people have got to know that what a Western part dentist is doing, which we are not doing it.
Correct.
Like every Western dentist is doing lectures right now, right?
Yes.
So you get to know that what people are doing across the globe and what we are not doing. The one thing. Second thing is, there are tons of online lectures which are happening. It is very difficult for an individual to go into Germany and go and take a course over there. It's fine. Everyone can understand. But now everything, it's like an fingertips away. You can just click on it and you get to know that webinar. You can learn from it. So there is a lot of things to learn out of it. There are things, instruments which you can learn online. We were thinking of veloscope. You can diagnose malignant cells at that time. So there are many things which you can learn out of that. It is just that we need to open our mind doors.
Correct.
And as a postgraduate, you need to understand one thing which is very clear is a don't stop anywhere. Don't stop. Just go with the flow. If you came across, there is a book with different, something different which is not related to you, read it. If you like reading it, read it. Don't stop for anything, because that process will make you know that, click an idea. If I randomly I'm talking to you, I will think of something. Okay, this girl is doing so great in digital marketing, and she's putting up such a great platform. So this will give me some other idea. Okay, you can do that also. You can do this also. You can I can ask you to do something for along with my diagnosticians to educate people. So there are many things which you can do. It is just have an attitude and never stop moving ahead. And apart from that, I would, at a present, as a postgraduate, I would suggest to make your base strong. If you like medicine, make something which no one knows. Try to be different. Try to learn something which no one knows. Try to make, if I like TMJ, I would master my TMJ like no one else has. If I like muscles, I will do something in my muscle disorders which no one does. So I need to create my specialty. I need to do something which no one else is doing and be the master of it.
Correct.
Right. If I heard the lecture and of you taking different lectures, every individual has stick to what they were doing it, and they have done something different from rest of their colleagues. That's why they are along with you in your interview, right? Otherwise, you wouldn't have taken it.
Yes, definitely, definitely.
Right. So that's what it's about. You need to take things, go ahead, keep moving, and start thinking differently. Start thinking different. Can you imagine a private company building up a spacecraft, building up, sending people to Mars? But
Yes.
Elon Musk did it, right?
Yes.
We always thought that only a government institute can develop such a thing, but he got the funds, he developed that thing,
Yes.
and now we look up to him. It's
Yes.
just that you need to think different.
Yes. Yes. So correctly said and so motivating. So, understanding about how you have done it and how you grow is also very, very important. And I really appreciate the fact that you mentioned that to think differently and to do something different by the others is something that you need to focus on, just go with the flow. So now, what is your suggestion for the current graduates or who are going for the post graduation, who are picking their branches up? Any suggestion from your end to help them understand to pick up OMDR, or anything that you think that motivates them to do better in their life?
One advice I would say is stop listening to anyone.
Okay.
You go and talk to them. See, I have a simple rule. When I feel that I'm on the sky nine, I will go to my family and talk to them. They will bring me down. When
Yes.
I feel that there people will have their own perspective for everything. Yeah, that theory that it is a half glass empty and it is half glass full is
Correct.
really applicable. Why
Correct.
you want to listen that how can you excel in prosthodontics or how can you excel in orthodontics?
Mm-hmm.
Even I know people who are genius along their they are university toppers, but in clinical practice they are not doing good.
Yes. Yes.
So your numbers, your degree doesn't define it. Your passion towards that degree define it. Like if I choose OMDR and I have to do a general practice, I would prefer don't waste the seat. Let other people do it.
Mm-hmm.
Do some courses in a general dentistry and settle and do in that way rather than waste a seat and do nothing out of it.
And waste your 3 years also. See, apart from the
Exactly, time is money.
yes.
At present, time is money. That's the difference between us, and the Western people is that they utilize their years very properly. They are very clear about what they want.
Hmm.
If they will choose something, they would have a clarity that okay, I need to pursue in it, and I want to excel in this field also. I can understand that in the beginning of your career, you will never think, and I would have never thought that after 5 years where I would be.
Correct.
But at least I can think that for next 5 months, I want to stick to this thing.
Correct.
There are people won't stick for 1 month also. They will
Yes.
keep on fluctuating. Okay, now I like OMDR, now I like oral surgery, now I like this.
Yes.
So, and you cannot master everything. You can succeed only in one field. You can diversify that field.
Correct.
If I know people in oral surgery who are not doing third molar extraction, they feel that that is not they graduated for. They are doing into orthodontic surgeries. They are doing into temporomandibular replacement.
Hmm.
So imagine if they would have thought कि ना मेरे को surgery पसंद है इसलिए मैं सिर्फ third molar ही निकालूंगा,
Hmm.
then they would have just run around different clinical practice removing third molar. They
Yes.
stopped there and thought that okay, what keeps me moving? What is my adrenaline rush?
Yes.
What makes me excited? Like if after this thing, if someone tells me that you need to see a CBCT scan, I won't take a second and I will go out. Okay, let it be. First, I will see the scan because
Yes.
it gives me an adrenaline rush that okay, I need to see something new.
Hmm.
I see something new. So every time you need to think that what makes you feel that thing. That
Hmm.
what extra. No field is smaller. No field is bigger. There
Correct.
is no people say that ortho is exclusive branch. Rest everyone can do everything. No, just imagine I can never match an endodontist in an RCT.
Yes.
He has given his 3 lives to that thing, 3 years to it. So he is going to bound to do better than me.
Yes.
So come out of it. Come out of that zone that this is exclusive, this is not.
Hmm. Hmm.
Every branch is exclusive. It
Hmm.
is just that how better you are with that field.
Correct. Correct.
If I say that I can do this, I can do that, but then I don't know, I can't do anything perfect, then I'm
Yes.
no one. I should do something which no one else can replace it. Then it will make me special.
Correct.
So
Correct.
this is what I feel, that as a postgraduate, just make a clarity. Okay, I like, don't put up like that. I like OMDR only because I heard him. He has done good. No, you might have three options. Explore those three options, but give your life a time span. Okay, if after 6 months I'm not able to clear out, then this is what I want to do it.
Yes.
And then after doing it, don't think about anything more.
Hmm.
Just stick to it, and just then there is one question: what else?
Yes.
That's the only question you should ask yourself. What else I can do? What else I can do? That's it.
That's so nice to hear, Dr. Suresh. It's so inspiring and it's so motivating. In fact, I'm sure all of our viewers are very motivated to hear him, to understand his views, and to understand his attitude of what else. So this is very, very nice to, that actually helps you to grow and to become a better practitioner or a better person, working for your clinical branch, your practice, or working on yourself is also something that people need to focus on. So thank you so much, Dr. Suresh, for taking out time on and helping us to understand about OMDR as well as about your journey. How did you grow yourself? How did you run through your journey? And how people can actually understand from your journey and replicate that, and also understand if they want to pick up this branch in OMDR, what are the kind of scope inside it. So
Thank
thank you so much for taking out time for this. And thank you so much, everyone, for joining us at this time. I'm sure this discussion would have motivated you to understand about the branch as well as to understand what all you should focus on to become a better practitioner. There is a lot of scope, lot of opportunities. It's just what you need to focus on is what you need to think. So do share this with your friends and colleagues. I'm sure it will be helpful for them as well to understand, to become what they should do to become a better practitioner. Also, do follow us on our Instagram as well as YouTube channels, where you can find all our old videos, which can also help you in your career growth. Thank you so much, Dr. Suresh. Thank you so much, everyone, for joining us right now. And have a nice day, everyone. Have a nice day, sir.
you.
Bye-bye.